Hey you guys, welcome back for another week of some tips, and we'll be doing practice questions all in one today. I wanted to pop on and go over a few things. I've received some questions and wanted to give you some updates. I've had requests on, feedback on preparing with practice questions, etc. But one of the big things that I tell y'all is to be aware of the test and choose based on your learning style. So I always like to kind of go over the blueprint, tell you to go look at the blueprints of each exams and get the information on that. So that's what we'll get into, and then we'll do a few practice questions today as well. Okay. So, as always, my disclaimer and my welcome to you guys. For those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I'm a family nurse practitioner and I'm the founder and CEO of the Nursing Studio. I do videos and I provide resources for nurses and nurse practitioners to help you and assist you with boards as well as in practice. Some things, guidelines change, and that's what we're actually going over today. Are certain things that they will have on test and things that I like to tell y'all in practice questions. So I'll always let you know if this is for current practice or what the test is currently testing on. Okay. So just be on the lookout for things of that nature. And, there's no absolutes in medicines. We treat on a patient by patient basis. So take these scenarios as such. Okay. All right, let's get into the updates and information. Okay, so I'm just going to go over FNP information. So with ANCC, the latest test was released September 28th, 2022. And I tell you this for all boards, the ANCC, AANP, I always say, and if you see my videos, I tell you to study assessment, diagnosis, evaluation, and treatment, because I tell you this is what they're testing you on. So when you are going through a scenario, study in those areas so that you are able to answer the questions in that format as well. And I'll go back into that a little bit more in a little bit, but that's their breakdown as well. Okay. So for the ANCC, they have an assessment area that is 19% of the exam with 29 questions. And that's your things like your health promotion, your screening, your family and caregiver roles, and risk assessments like those behavioral assessments, cultural assessments, and things of that nature. So that's 19% of the exam with 29 questions in those areas. Now, diagnosis is 17% of the exam with 26 questions. And just like I tell you, so with diagnosis, those are like your differential diagnoses, your diagnostic tests, always thinking of those gold standards, and then being able to differentiate between normal and abnormal changes, right? So, remember when I tell you assessment, diagnosis, evaluation, and treatment, I say with assessment, know that presentation, know those signs and symptoms, etc. That's what they're telling you in all of those areas that I listed. There's 29 questions. And then, diagnosis, just like they say, those are your differentials that you come up with. Those are those gold standard diagnostic exams. And then planning, there's 29 questions for this as well. And that is considered like your primary, your secondary, and your tertiary prevention, things that go in that area. Those anticipatory guidance factors, disease progression, evidence based practice on how you will plan accordingly for certain conditions so you can move into the treatment options, right? And the things that you are assessing, right? And and then lastly, we have that implementation and evaluation. So implementation is majority of the exam, honestly. It's 29% of the exam with 43 questions falling into that category. And on the ANCC, that's those legal and ethical issues, those non-pharmacologic interventions and treatment options like your procedures and biopsies and imaging and things that you would do as the treatment source. And then like certain guidelines like STDs that you will report, abuse reporting, things of that nature. That's what falls into excuse me, into the implementation category, being 43 questions on the exam. And then lastly, we have evaluation, which is 23 questions on the exam. So for me, I always like to give the example on like pneumonia when I give the rundown on how to utilize assessment, diagnosis, evaluation, and treatment when you study. That's my little tidbit that I tell you. When you're Starting from the top, you're reviewing, you go condition by condition, and you're asking yourself these things. And if you study in this breakdown, you're going to retain it and you'll be able to apply it better. So I feel a lot that, we go through this material, we learn it, we know it, and you know it on a large scale. But studying this way helps to break it down into smaller chunks for an application process. You know what I mean? So when I say this, I say I like to give you the scenario with pneumonia. So think about, how does pneumonia present? They can have a fever, a cough. They may begin to feel weak. They may have brown colored sputum. Right? Um, then, so that's assessment, right? So that presentation. What are their signs and symptoms? How do they look? You know. So what are you looking for? What are you assessing when this person presents to you in the office, right? Diagnosis. What differentials may you have? What diagnostic tests can you do? If there's gold standards, that's always what you go with. So what is the gold standard diagnostic exam to give you a confirmation on a differential diagnosis of pneumonia? It's a chest x-ray, right? So that will be your diagnosis section. Evaluation planning, all of that I put in together. So how do you evaluate? You're looking for any progression. You're looking for if they have been on any antibiotics previously. You're evaluating the full scenario, right? And then treatment as your last, like, how would you treat? Are you going to give them a macrolide? Do they have any allergies, etc.? If you go through that breakdown through all the conditions that you're studying, you'll be successful. You will retain it. You will be effective in on boards as well as in practice, right? Okay, so that's ANCC. So again, from the top, assessment is 29 questions, diagnosis is 26 questions, planning are 29 questions, and implementation is 43 questions, evaluation is 23. And I know that's kind of real generic. I tried to give you the tidbits on there. Go to the website, look at the blueprint, it will give you the breakdown. It'll also show you each system that is on there. All the systems are on there, but they also provide asterisks by certain systems. And on the ANCC site, the ones with the asterisk by it are the ones that are not heavy on the exam. You can also go and look up the updated guidelines. So that's how I know when I'm teaching you guys or doing my videos or doing my classes, to tell you what they're currently testing you on these current exams, because it'll show you the areas and the resources that they're currently utilizing, so you know what guidelines to go by. Okay. All right. And then next, the AANP FMP blueprint. So the AANP just released one for 2024. There's 150 questions on the exam. 15 of those are pre-testing questions. So 135 are the ones that are scored. So again, broken down as assessment, diagnosis, plan, evaluation. Same scenario, right? So with this, for assessment, they have 43 questions for their assessment. For diagnosis, they have 36 questions. For planning, they have 36 questions. And for evaluating, they have 20 questions. They'll give you a breakdown as far as the age group, like newborns, adults, adolescents, etc., on how they are broken down into those classifications in that assessment, diagnosis, planning, and evaluation. But I also want to explain what falls into those categories, right? So with assessment, same thing like I'm telling you. It's talking about how you obtain like the subjective part of the patient information, like what's that chief complaint, the review of system, their history, that physical exam, all the things. What's their presentation, their signs and symptoms? Remember, I'm telling you, like pneumonia, how do they present? And so they they just include those areas to tell you to take a look at those when you are reviewing those. So again, what I'm saying is I'm telling you this for not just because this is the way I teach, but I'm telling you from what they're testing you on, and even from seeing it from an unsuccessful side of the feedback they give you, so that you can interpret this in a way so that you know how to study for that, right? Now, diagnosis. This is the synthesis and analysis of that subjective and objective information. So, and prior to prioritizing those differentials. So, same thing we just talked about. So, you're analyzing the signs and symptoms, and you're starting to think, hey, this may be pneumonia. So let's do this to confirm my possible differential diagnosis, right? So I'm going to do this chest x-ray to confirm if it is pneumonia, right? Um, they have their planning section, which I say is like evaluation and all that. But planning here, just coming up with a patient-centered plan, something that's evidence based. So, of course, if you're studying, you're going to study in that fashion. Like, what do we look out for? What are we evaluating for? Again, with pneumonia, we're looking to see if you've been on antibiotics before. Do they have other comorbidities? With that presentation, has something already been initiated? Are there referrals or consultations we may need to do, etc.? And then, lastly, that treatment plan of care, etc. Okay. With this, they tell you knowledge areas for the AANP to not know the diagnostic test that you would do. If there are any specialized assessments, make sure you know that. So, for example, like dementia, doing that mini mental status exam, being familiar with those type of assessments, health history, physical exams, knowing your patho, the comorbidities, the treatment options, pharmacologic as well as non-pharmacologic treatment options, and then being knowledgeable about those evidence informed practices, like, and I'm just going to tell you the list that they have on their site, like crisis management, diagnostic reasoning, health promotion, harm reduction and disease prevention, healthcare economics, like the cost, the billing. So that's why I like to teach you. You can see if you go to my non-clinical videos, that's why I go over the stuff for CMS, the billing structures, understanding occurrence based, billing, incident to billing, all of those things. Be familiar with that stuff. Professional practice, legal and ethical issues. And let me pause for a second and tell y'all sidebar. This is the AANP site blueprint. So I know people always say, there's no non-clinical. And I tell you guys, know the non-clinical content for both exams. There is non-clinical stuff on the AANP. The major difference is on the ANCC, it's going to be outright. If we're talking about a cultural practice, they're looking for a cultural answer. Now, on the AANP, there's very few questions where you're giving direct answers on a non-clinical standpoint. It's more so in the scenario. So it's gearing your mind. You know how sometimes it's like you feel like the information in there, it it helped you to form the next steps that you would do in your treatment, in your plan, but it didn't make or break your answer. Well, that's kind of how they build the scenario and giving you the background on some of those things as well. So make sure you're familiar with it. But I'm going to continue the list of things that it's telling you to have a knowledge base on. It says legal and ethical issues, patient and family education and counseling. That is huge. Patient centered care, family being included in that patient-centered care. They have principles of epidemiology, population health, and social drivers of health, procedures, transitions of care, cultural responsiveness, therapeutic communication, and pain management. Same as I told you with the ANCC, I want y'all to take a moment and go to the site yourself. As you're preparing, as you're making your study list, go to the site, look up the blueprint because they have it for each individual certification. I'm just going over FMP. They have adult general, they have psych, everything. Whichever, if the test is testing, it provides that exam. They have the pediatric one. Go and take a look. They'll have it listed out, and it gives you several things. They give you resources. They give you like a quick 20 question exam so that you can look at. They give you the blueprint, and then they give you the things that the content that's on there so you can know what guidelines. And also now the ANCC has a readiness test that you can to try out to kind of see, and it goes through like a prometric thing, but it has you do a full test so you can kind of get a feel of what to expect on the actual exam, which I think is a good thing as well. It's very beneficial. So just want to give you those tidbits really quickly. And then I always get questions on tips on preparation and how I think to look at it and how you should practice, etc. My um thing to everybody is, and you probably have heard me preach this over and over, but practice questions. Continue to do practice questions. I'm not telling you on each day you have to do hundreds of them. That's not what I'm saying. Do, because if you're doing it and you're not retaining and you're fatigued and you're not able to retain the material, then you're just doing it to say you did it. You're not having any benefit from it. So smaller chunks are often better, but I also recommend that you're gradually building, because you need to get that strength and that muscle memory so that you don't fatigue on the exam. So hey, today you may do 15 and the next day do 20, and you sit at that for this week. Next week you're bumping up in the 30s, the 40s, and maybe once a week you're giving yourself a large full exam, to do the 150 of the questions, etc. But as you're studying, I say study in small chunks so that you're able to do the practice question, complete it, see which ones you have gotten correct as well as incorrect. The ones that you have gotten incorrect, I want you to spend more time on those, but I want you to go and review all rationales on all the questions. Those ones that you have incorrect, make a list. Get you a notebook strictly for this. Make a list of your of the rationales incorrect, go back, review it, but each night go back over the rationales for those incorrect ones, because you're trying to ingrain that in your head, because you're getting it wrong for a reason. So that is my tip for when you are how many to do and a way to actually study them. Now, to complete a practice question, y'all know I always tell you, read the stem of the question first. Again, just like I was telling you about scenarios, and sometimes all of this stuff really does not change the answer, or how it may um, be an actual answer choice. It may be just something in there to give you knowledge and foundation in the scenario. But read that stem so you're not creating your own storyline. Read the stem of the question so that you are truly answering what is actually asking you. Okay, read that stem. Then I want you to make sure, I always tell you, know those key identifiers associated with certain conditions, like silvery plaque, silver plaque, you should think psoriasis, so I always say, if I say silver plaque, you say psoriasis, right? So like things like that, know those key identifiers. Also make sure you know words, those absolutes, because things like accept, not, always, best, first, initial, know those things, especially if it's in the stem of your question, because it's going to slow you down. Don't make a mistake because you missed that key little word um, on how to address this question. Then I want you to make sure that you are reviewing all answer choices. You can typically eliminate at least one or two of those. Read them, and if you can eliminate those things. They have striking options on the exam. Use it so that you're not confusing yourself. And then make sure that you're answering all the questions. Don't skip them. Now, my recommendation is do not change any of your answers unless you know 100% that is incorrect. Otherwise, don't change it. Now, I know they do give you the option to flag your questions so that you can go back to them. Now, for me, that's not beneficial. And I'm going to tell you why. And I have told a lot of my review students this. If you have test anxiety, if you have already answered this question, right, and you have bypassed this question and you weren't sure, what makes you think that after you have gone through 150 plus questions, that now you are sure? Is only going to put you in that mindset to go back and change your answer, right? And we don't change answers unless we know for sure that we are 100% incorrect, right? So flagging it, now you're at the end of the test. You're tired. You're stressed. You don't know what to think. You don't know if you passed or if you didn't pass. You're starting to question yourself and question everything that you have done this far, right? And then now you want to go back and look at all the ones that you felt uncertain about. And then you're looking at all these flag marks, and then you go back and look at that. Now you're over here questioning everything, and then potentially changing stuff that you have correct. So that's why I don't like the flagging option. Now, some people, it may work for you. You go with what works for you. But that's my tips. Okay. And that's everything. That's all I got to say about all the stuff. I recommend, again, go to the website. Google, it's simple. Google it. Just say FNP blueprint on such and such exam, and it'll take you right to it. Easy peasy, right? All right. Now that I have given you my rant, my tips, my feedback, let's get into a few questions for this week, okay? And I just decided to do some random questions because we're not really covering a specific topic or anything right now. But I just want to really get into practice questions because that's what I have been getting a lot of um, questions and requests on. So let's just test knowledge and go through, okay? This one states a 32-year-old female presents to the office for follow up. She does not have a past medical history. Her blood pressure today is 148 over 92. She states that she has kept a BP log at home for the past month with systolic readings ranging in the 140s to 150s. Based on these findings, how should the nurse practitioner treat? Would you prescribe A, HCTZ, B, lisinopril, C, metoprolol, or D, amlodipine? Take a moment and tell me what you think in the comments, okay? All right. As I told you, we read the stem of the question first to ensure that we're answering what is truly asking us. So the stem of the question states, based on these findings, how should the nurse practitioner treat? Now, I know, again, this is just a scenario. You may do some other things, but here we are. We have a 32-year-old female. She's pretty healthy, doesn't have a past medical history of anything already. Her blood pressure is elevated today at 148 over 92. She has kept a BP log. Her systolic blood pressure have been ranging in the 140s and 150s for a month. So we're going straight to treatment options and we want to know how to treat, right? Or should you treat? So remembering that we do the ACC and AHA guidelines right now on the boards, and that's what they're still currently testing on. And with those guidelines, it tells you for patients, we no longer look at the age or anything else, right? We're looking at, no matter the age, we look at what the blood pressure reading is and if they have any comorbidities. So if they do have comorbidities, we don't want that blood pressure to be greater than 130 over 90, right? Because if you already have risk factors, we're not trying to have additional risk factors uh, with the blood pressure being elevated. Now, if you don't have any comorbidities, 140 over 90s, we don't want our blood pressure to be greater than. Or if it is, we immediately start treatment. That's also the thing with these ACC and AHA guidelines. We go directly into treatment, okay? So here we clearly see 148 over 92 is exceeding that 140 over 90 range. She doesn't have comorbidities. We need to start treating. Treatment option goes to what we were already doing when we were on the JNC 8 and etc. guidelines, that thiazides are your first line therapy, right? Thiazides are the first line therapy. So A is your answer, HCTZ. Now you do know if they have a history of diabetes, kidney issues, we want to go with the ACE or ARB to protect those kidneys. But she doesn't have that. So you can eliminate B, lisinopril being an ACE inhibitor. Beta blockers are not even really in that initial treatment option. And then D, amlodipine is a calcium channel blocker. Now, in African American patient combo, meds do work better, but thiazides are still first line therapy. And then if that's not working, then you will combine with a calcium channel blocker. But here, your best answer for this healthy 32-year-old female with no comorbidities, with a blood pressure exceeding that 140 over 90 range, we're going to go with thiazides. So your answer is A, HCTZ, okay? All right, next question. A pleasant 76-year-old female presents to the office today for an annual follow up. She states that she has had increased changes in her mood since the loss of her husband and sister in law. She states that she does not have the desire to do anything. She doesn't leave her home or complete any tasks. She states that this has worsened over the past 6 months. Based on these findings, what is the best diagnosis? Is it A, generalized anxiety disorder, B, major depressive disorder, C, minor depressive disorder, or D, nothing at this time and continue to monitor? Take a moment and tell me what you got in the comments, y'all. All right, let's read the estimate of the question first. So based on these findings, what is the best diagnosis? So when you know, if we're coming up with a diagnosis, what are we doing? You remember I tell you, think assessment, diagnosis, evaluation, and treatment, right? So to diagnose something, we have to go back and think about our assessment. How do they present? What is that history, right? We talked about all of these things. So 76-year-old female, she's here for an annual follow-up. She is expressing mood changes. This has been going on. and worsening over the past 6 months. She has lost a husband as well as sister-in-law. She doesn't want to get out and do anything. She can't complete any tasks. She has no desire to do things. So here, this sounds like depression, right? We can eliminate A because it's not anxiety. She doesn't sound anxious at all. We can eliminate D, nothing at this time. Yeah, you will continue to monitor the patient, but we need to do something. This has been going on for more than 6 months, right? So here we are with depression. So what do you need to be able to identify and know major versus minor depressive disorder. With major depressive disorder, having these mood changes for 2 weeks or greater is considered major. If it's less than that, we consider it minor. So the best answer choice here is B, major depressive disorder, because she's been going through this for more than 6 months, right? All right. All right. Next question. A 66-year-old male presents to the office today with complaints of gradual vision loss, tonometry completed, and the patient has been diagnosed with open angle glaucoma. What would be the best treatment options? Is it A, timolol, B, refer for surgery, C, follow up in 4 weeks, or D, ciprofloxacin drops? Take a moment and tell me what you think in the comments. All right, you guys. So let's read the stem of the question first. What will be the best treatment option? So the diagnosis, again, think assessment, diagnosis, evaluation, treatment. So we have a diagnosis of open angle glaucoma. So how do you treat open angle glaucoma? Are we going to do timolol drops? Yep, A is the best answer for that, because for open angle glaucoma, where they had that gradual vision loss, we will do beta blocker eye drops to kind of help reduce that intraocular pressure. B, no, you don't want to refer to surgery. We refer out for an emergent case for closed angle glaucoma, right? For closed angle, that is the emergent case. I always tell you guys, like, open angle is gradual. Our eyes are still open. But, my brilliance, I say for that is closed angles, the eyes are closing quickly. They can go blind very quickly. So it's emergent, get them out, refer them out, right? We're not going to wait and follow up in 4 weeks. We need to go ahead and start getting things taken care of. And the ciprofloxacin drops is not what we do for open angle glaucoma. Alrighty, a nurse practitioner notes a systolic murmur at the fifth intercostal space. What diagnosis shows understanding of the type of murmur found? Is it A, aortic stenosis, B, mitral regurgitation, C, aortic regurgitation, or D, mitral stenosis? Take a moment and tell me what you think in the comments. Think about your murmurs. All right. So, stem of the question states, what diagnosis shows the understanding of the type of murmur found? So, as I always tell you guys, with murmurs, there's tons of mnemonics out there. So, go with how you learn it best. Don't try to learn 10 different ways. Pick one, stick with that, and then use it as we go along. So it's telling you, this one is pretty straightforward, but there's so many ways to describe the murmurs. And if you struggle with it, go check out my video on murmurs to kind of help you guide it in a short and sweet fashion. But here it's telling you it's a systolic murmur. I always tell you, you need to know systolic versus diastolic. This is when we're just trying to identify these quickly for questions. But systolic versus diastolic, right? Because 2 fall in each. And then the location, right? So here is systolic. It's a systolic murmur. So what are your systolic murmurs? With Brittany's brilliance, I say sassy systolic says that men really are stupid, right? So men really being MR, mitral regurgitation, are stupid, aortic stenosis, right? And then your diastolic are the 2 opposite of those. So, all right, cool. So we know it's either mitral regurgitation or aortic stenosis. So either B or A. That's what we're down to, right? Now the location is the 5th intercostal space. So where's the aortic location is where's the mitral? Aortic comes first in the alphabet, right? And that's at the 2nd intercostal space, right? At the base of the heart. Just giving you terms that they may utilize to describe that actual location. And then mitral location is at the 5th intercostal space, right? At the apex of the heart, right? Okay, so here is 5th intercostal space, so you know it's mitral. So your answer would be B, mitral regurgitation. All right, and last question for today. A patient presents with complaints of a unilateral headache and photophobia. The nurse practitioner is considering abortive therapy options. What shows the nurse practitioner's understanding of the appropriate therapy? Is it A, Elavil, B, Depakote, C, propranolol, or D, sumatriptan? Take a moment and tell me what you think in the comments. All right. So, stem of the question states, what shows the nurse practitioner's understanding of the appropriate therapy? So here, patient has unilateral headache and photophobia, and we're considering abortive therapy options, right? This unilateral headache with the photophobia is classic for migraines, and there's abortive therapy options and there are prophylactic therapy options. Again, identify those keywords that they're giving you so that you're not missing and making careless errors because you're missing little terms to tell you how to answer this question. So your best answer is D, sumatriptan, because triptans are the abortive therapy for migraines. All three of the other ones, Elavil, Depakote, propranolol, are prophylactic therapy options. So your best answer choice here would be D, sumatriptan. All right, you guys, and remembering that we don't give triptans for people with certain heart issues, cardiac issues, and we don't give it to those who have hypertension. All right, you guys. So I hope you found this helpful with the blueprints for the ANCC and AANP. Take a moment and go check out the ones and get yourself prepared for whatever exam you're taking and whatever specialty it will be in. Um, Also, hopefully, you're finding these practice questions helpful. If you take a look, I have adjusted the playlist. So if you click playlist on this page, on the Nursing Studio page, I have designed some playlists to kind of help organize some of these. I may change them around a little bit to group them together because you can only have a certain amount, but there is an actual practice question playlist. So there's about 34 different videos under there of practice questions. Now there are more practice questions under certain systems that I did along with that, so you can continue your studying flow, but there's 34 random videos on practice questions. So and go check them out and test your knowledge and study along. I'll be doing more. So these things will get added into those groups. But I wanted to give you a current, up-to-date one so that you're ready to be successful for this year on exams and in practice. But as always, you guys, thank you for watching. Be sure to like, comment, subscribe, and share with whomever may find this beneficial as well that you think. And make sure that you meet me back here for more tips, tricks, and practice questions. If y'all have any questions or concerns or would like some assistant one-on-one sessions or any of our resources, be sure to reach out to us. You can shoot me an email at the nursingstudio1@gmail.com or at Gmail, or you can give us a call at the Nursing Studio at 803-400-6864. All right. Bye, y'all.